Your feet might be warning you about diabetes right now. And the most dangerous part is you'd never know it. Not tingling, not pain, not anything dramatic. Just quiet, ordinary things you've been explaining away for months, maybe years. A heel that keeps cracking no matter what lotion you buy. A foot that feels cold under 3 blankets. A small cut that just won't close. You walked past every single one of them. So did your doctor. The standard medical appointment is 12 minutes. Blood pressure checked, prescriptions renewed. And then you leave. Nobody looked at your feet. That's not an accident. That's a system. And that system is why over 8 million Americans right now have diabetes silently destroying their nerves, their kidneys, their circulation, and feel completely fine. Last year, a 68-year-old woman sat in my exam chair. For 2 full years, she had been standing in drugstore aisles buying every lotion she could find because her heels wouldn't stop cracking. Coconut oil, prescription cream, soaking every night. Nothing worked because it was never dry skin. It was her nervous system shutting down, quietly, while she stood in the lotion aisle reading labels. Her blood sugar had been critically high for 3 years, caught not by a blood test, caught because someone finally looked at her feet and asked the right question. Today, I'm asking you that question. My name is Dr. Deborah Williams. I've practiced medicine for 23 years, and I'm going to show you 9 things on your feet I look for in every patient over 55 who walks through my door. Each one is visible right now. Each one has a name, and each one is your body asking for help in the only language it has left. Take your socks off. I'll wait. Now let's look together. But before we get into the 9 signs, I want to know something. How old are you? And where are you watching from right now? Drop your age and your location in the comments below. I read every single one. I truly want to hear from you. Because the people who need this video most are usually the ones who've been sitting in waiting rooms for years, being handed prescriptions, but never being given information. And I want to know exactly who is in this room with me today. Go ahead, I'll be right here. 1 in 5 Americans with diabetes don't know they have it. Over 8 million people. And 113 amputations happen every single day in this country because of diabetic foot complications that started as warning signs, exactly like the ones I'm about to show you. A $12 blood test at any certified lab, covered by Medicare for most of you, can catch this early. But first, you need to know what you're looking for. Sign 1. Tingling and numbness. Almost every patient has felt this and explained it away. My foot just falls asleep sometimes. I was sitting with my legs crossed. I always ask one question. Is it happening regularly without any reason you can point to? Because if yes, your nerves are asking for help. Think of your nerves like electrical wires. Every wire has a protective coating. When blood sugar stays elevated, that extra sugar slowly eats through that coating. The signal gets fuzzy. And that fuzziness, that tingling, is your nerve telling you the damage has already begun. The American Diabetes Association says peripheral neuropathy affects nearly 50% of all people with diabetes. It almost always starts in the feet, years before a formal diagnosis. Daily habit? A 20 to 30-minute walk every day, and reduce added sugar starting today, not next month, today. Sign 2. Burning pain at night. Not during the day, at night, when the house is quiet and there is nothing to distract you from the feeling that your feet are on fire. Most people blame tiredness, heat, being on their feet too long, but burning pain in the soles of your feet at night when nothing is touching them is a damaged nerve misfiring, sending a heat signal to your brain with no physical cause. Think of a fire alarm with a broken sensor. The building is not on fire. The sensor just can't tell the difference anymore. Research in diabetes care found this symptom appears on average 1 to 3 years before a formal diagnosis. 1 to 3 years of lying awake, of explaining it away. Daily habit? 8 glasses of water daily, and add fiber to every meal. Fiber slows sugar absorption. That slowdown is exactly what those damaged nerves need. Sign 3. Wounds that won't heal. This is where uncomfortable becomes dangerous. Patients come in and say, "I had a small blister 3 weeks ago. I figured it would close." Most wounds do close. Not when blood sugar is high. The tiny blood vessels in your feet narrow and stiffen. Oxygen, white blood cells, the nutrients that repair tissue, they cannot reach the wound. The healing ingredients exist in your blood, they just can't get there. Think of a garden hose with a severe kink. The water's there, it's just not arriving. The CDC reports diabetic foot ulcers are the leading cause of non-traumatic amputations in the United States. Over 100,000 per year. Almost all started with a small wound somebody decided to wait on. Daily habit. Tonight, after your shower, look at both feet carefully. Every toe, every heel, any cut or blister, clean it, apply antiseptic, cover it. Not improved in 48 hours? Call your doctor. Not next week, 48 hours. Sign 4. Skin discoloration around the ankles. Patients show me darkened, reddish, sometimes bluish skin around their ankles and say, "I thought it was sun damage. I've always had dark skin there." Maybe, but there's a specific pattern I look for when circulation is compromised. When blood sugar damages the vessels along the route to your feet, the skin in those areas stops receiving enough fresh, oxygenated blood. It darkens, it thins, it becomes fragile. Your blood is a delivery truck. Your feet are at the end of the longest route in your body. When the roads narrow, the deliveries stop arriving. The skin changes color. That is a distress signal you can see with your own eyes. A study in the Journal of the American Academy of Dermatology found these changes are detectable on average 18 months before a formal diagnosis. Daily habit. 5 minutes every morning. Ankle circles, toe raises, calf stretches. That small movement pushes blood into the lower legs. If you sit for long periods, elevate your feet even 2 inches. It makes a meaningful difference. Sign 5. Cracked heels that never heal. You already met this sign, the woman in the lotion aisle. Now I'll tell you exactly why no lotion worked. Your autonomic nerves control functions you never think about. One of them is regulating the sweat glands in your feet, the glands that keep your skin naturally moisturized from the inside. When blood sugar damages those nerves, the sweat glands stop receiving instructions. They stop working. Your feet lose their internal moisture source. No lotion fixes that, because the lotion addresses the surface. The problem is the nerve. Think of your skin like a sealed wall. The autonomic nerves are the workers maintaining the mortar between the bricks. When the workers stop showing up, the cracks appear. And in a foot with poor circulation, those cracks are not cosmetic. They're open doors for infection. The American Podiatric Medical Association identifies chronic, hard-to-treat heel cracking as a significant indicator of autonomic neuropathy, directly linked to long-term elevated blood sugar. Daily habit. Moisturize every night before bed. Coconut oil or thick, unscented lotion on the sole and heel. Never between the toes. Trapped moisture breeds fungal infection. And drink your 8 glasses of water. Your skin needs hydration from the inside, too. I want to stop here for a moment. Have you recognized any of these signs? In your own feet? In someone you love? If yes, go to the comments right now and type yes. Capital letters. Just that one word. I read every single one. And if this video is giving you information your doctor never gave you in that 12-minute appointment, hit the like button right now. 1 second. It tells YouTube to put this in front of the millions of people who need it and don't know it yet. 4 more signs. And sign 7 is the one sending more men into the emergency room than almost any other. Sign 6. Swollen feet and ankles by evening. I've been on my feet all day. Of course they swell. Sometimes that's exactly right, but press your finger into the swollen area if the dent stays for several seconds after you lift your finger. That is pitting edema. That is fluid, and it is telling you something about your kidneys. High blood sugar damages kidney filters over time. When those filters are compromised, fluid accumulates and gravity pulls it to the lowest point in your body, your feet, your ankles. The National Kidney Foundation reports diabetic kidney disease affects 1 in 3 adults with diabetes, and this swelling is frequently the first visible sign that kidney function is under stress. Daily habit. Elevate your feet above heart level when you rest. Reduce sodium, read labels. Canned and processed foods are loaded with it. Sodium makes fluid retention significantly worse. New or worsening swelling, tell your doctor at your next visit. Sign 7. Stabbing or electric pain. Men especially. They come in after months of ibuprofen. They say, I thought it was arthritis, an old injury. I hear this constantly. And ibuprofen will never touch this pain because it is not coming from a joint. When nerves are damaged by high blood sugar, they don't always go quiet. Sometimes they go haywire. They fire randomly. Patients describe stabbing, electric shocks, a hot needle through the foot, almost always at night. Think of a car alarm damaged in a fender bender. Nobody is breaking in. The car is safe. The alarm just cannot tell the difference anymore. That is a damaged nerve, screaming for no reason, while the damage underneath continues, and the ibuprofen just makes it slightly harder to hear. A landmark study in the New England Journal of Medicine found painful diabetic neuropathy affects 25% of people with diabetes and is regularly mistaken for arthritis, delaying diagnosis by an average of 2 years. Daily habit. 5 minutes of gentle foot and ankle movement before you get out of bed every morning, and 3 minutes of light circular massage along the sole each night. Your nerves need circulation. Give it to them. Sign 8. Permanently cold feet. I've always had cold feet. My husband has stolen the electric blanket for 30 years. I laugh with my patients when they say that. Then I ask, are your feet cold in July? Cold under 3 blankets when the rest of your body is warm? Because that is a different thing entirely. Persistently cold feet, regardless of temperature or season, mean warm blood is not reaching your feet in sufficient volume. Your blood vessels have narrowed to the point where the heat cannot complete the journey. Think of heating pipes running through a house. When the pipes narrow, the heat never reaches the last room. Your feet are the last room, and they are cold because the pipes are damaged. The American Heart Association identifies peripheral artery disease caused by exactly this narrowing as affecting over 8 million Americans. Diabetes is the single largest risk factor. Persistently cold feet are one of its earliest consistent symptoms. Daily habit, a 30-minute brisk walk every single day. Purposeful, arms swinging. This forces circulation into the feet, strengthens vessel walls, and over time can begin to reverse early narrowing. Start with 10 minutes if 30 feels like too much. Just start today. Sign 9. Hair loss on the lower legs and feet. This is the one nobody talks about. I have never seen it in a patient brochure, and every single time I point it out during an exam, the patient looks down at their own legs and says, I never noticed that. That is exactly the problem. Look at your lower legs right now. Look at the tops of your feet. Is the hair significantly thinner than higher up on your leg? patchy, absent entirely? Hair follicles need a steady supply of blood and oxygen. When circulation is compromised by long-term blood sugar damage, those follicles stop receiving what they need. They don't die suddenly, they just quietly stop producing hair. Think of follicles like plants on a drip irrigation system. When the pipes narrow, the plants stop growing. Not all at once, gradually, until one day you look and realize nothing has grown in a very long time. That absence is a message about your blood vessel health that has likely been visible for years before anyone thought to look. Research in diabetes, obesity, and metabolism found lower extremity hair loss correlates significantly with peripheral vascular disease in diabetic patients, a clinical marker physicians are specifically trained to check for during foot examinations, which requires someone to actually look at your feet. Daily habit. Right after this video, look at your lower legs in good light. Compare the hair density to higher on your leg. If you see thinning or absence, schedule a blood glucose test this week. Not this month, this week. $12, any certified lab. Medicare covers it for most of you. $12 could change the entire direction of your health. We covered 9 signs today. 9 chances to catch something before it catches you. The hardest part of my job is not complicated diagnoses. It is sitting across from a patient who has had 7 or 8 of these signs for 2 years and is only finding out now. Not because they didn't care, they just didn't have the information. You now have it. Tonight before bed, sit down in good light. Look at both feet. 30 seconds. If you see or feel anything on this list, call your doctor tomorrow. Not next week, tomorrow. Because caught early, in the vast majority of cases, this is manageable through diet, through a daily walk, through one conversation with your doctor. You worked hard for your independence, for your health, for the life you have. Don't let blood sugar take any of that from you because nobody told you what to look for. Now you know. Share this on Facebook right now. Tag your spouse, tag a sibling, tag a friend who has been complaining about their feet for months. You may be giving them something they didn't know they needed. I post every week on this channel, conversations your doctor would have with you if appointments were longer than 12 minutes. Subscribe and bring someone you love with you. I'm Dr. Deborah Williams. Take care of those feet. I'll see you next week. This video is for educational purposes only and is not medical advice. Always consult your physician or qualified healthcare provider before making any changes to your health routine. If you are experiencing any symptoms discussed here, please seek professional medical guidance promptly.